Hello and welcome to Unstress Health. My name is Dr. Ron Ehrlich. Well, today we're exploring a topic that truly sits at the intersection of dentistry, medicine, whole body wellness. My guest is Dr. Ben Javid. And Ben is a holistic dentist, a wellness expert, and the co-founder, together with his brother Sean Javid, of Smilebody, a groundbreaking holistic dental and medical wellbeing center in California. Now, we're going to dive into how oral health is not just about teeth and gums, something that regular listeners would be well aware of, but a powerful gateway to systemic health and longevity, and even the prevention of many chronic diseases. Now, as I have often said, if you are not including on a comprehensive oral exam into at least once in your life, particularly if you've been diagnosed with a preventable chronic degenerative disease, which would include heart disease, cancer, any one of 100 autoimmune conditions, diabetes, even mental health issues, even erectile dysfunction, fertility, you name it. The common denominator is chronic inflammation, and that is where oral diseases fit in, but it's also a conversation about sleeping and breathing. It's also a conversation about meridians that run through the whole body. So sit back and get ready to think about what oral health really means in whole body health. I hope you enjoy this conversation I had with Dr. Ben Javid. Welcome to the show, Ben.
Dr. Ron, it's wonderful to be on this show. Thank you for having me.
Ben, when I got the invitation to have you guys on the show, and I'm talking about you and your brother Sean, who's not with us, but I couldn't help but be attracted to it because my brother and I have worked together in this holistic dental, or biological, as you call it in America, space for over 40 years. So this was an immediate, must talk to you guys. I'm intrigued by your journey because when you graduated from dental school, I'm pretty sure biological or holistic dentistry wasn't high on the curriculum. What was the journey for you? What prompted you to make this transition?
Well, first of all, before I answer that question, Ron, I want to thank you for putting on a show like this and spreading information that is actually helping people get healthier mentally, physically, and spiritually, actually in every way. It's a wonderful thing that you're doing that's touching people in many ways. That's what we try to do at our level. Now, with biological or holistic dentistry, it's a mindset. It's a mindset of, and it's not something you go and learn at a course like doing veneers or dental implants. As you know, it's something that you have to live by. You live by it. In fact, you live by it before you actually practice it in your practice. I mean, that's how I think about it. And for me, everything that I've done in my life has led me to this. It's not just one thing. What I mean by that, it's, for example, how I grew up. In our home, my dad and we're always against prescription meds. We never really utilized prescription meds very much. It was more about what you're eating healthy. So eating the right way, take care of your body, and then you're relying on meds for just everything. Whether it's a headache or a pain or shoulder ache or back ache or something more serious. But so that over time evolved after I went to dental school. Some of the things I graduated in 2002, we still learned to put in mercury fillings. That was the standard of care. At that time still. And, it didn't really make sense to me that much because it's more than 50% mercury. But, you got to do it. You got to pass the boards, do those mercury fillings and pack it in and do everything that we had to do to go through the training and get our license. That's when I stopped doing mercury fillings after I got my license. It didn't make sense to me at all during school or after school. But one thing I did graduate with was a hunger for more. I didn't feel like my education was finished. I felt like there has to be more than what I've learned in school. And not in what I felt very confident in my education. Uh, um, I felt like, the school trained me to be a outstanding dentist. Of course, you keep learning; it never ends. But personally, my philosophy was to keep growing in every way I can, and that resulted in learning more about personal growth and nutrition, everything from spiritual growth like Deepak Chopra and Wayne Dyer and other those kind of meditation and what's possible there, quantum physics, and also the world of like Tony Robbins and learning your own potential and so for me that was I was very hungry for that, and my brother luckily was in line with that as well. He's 7 years older. He was a dentist before I went to dental school. So, but a lot of our vision was aligned, and at the time back then, really, like you mentioned, there wasn't really much about holistic dentistry. There was practitioners out there, but it's not something I even knew about. What I did like is the artistic ability to make smiles. And so I got into cosmetic dentistry at the time. And so it was, someone you can touch people's lives and change their smile and make them feel confident about themselves and so on and so forth. So, we got into cosmetic dentistry and we were doing a lot of cosmetic dentistry. And it was great. And then there was a recession and things changed, and we started doing more and more surgeries and implants, and more services of different kinds, and sedation dentistry, and we got into orthodontics a little bit, and so I got a diplomate in sleep medicine at one point, treating sleep apnea, and so it kept evolving. At one point, I did extra training right after dental school for root canals. In fact, so I did a lot of root canals in my time too, because I wanted to do it at the highest level. So I did root canals, and I did all the mainstay of dental. But as I kept growing personally, I had to start questioning, what we're doing, because if you're doing everything like you did in dental school, it's very easy. That's all there is to it. But if you're in the mindset of growth, you realize that everything they taught in dental school is not necessarily the truth or the way it is in the real world. So this evolution was not a light switch. It's a gradual evolution. And of course, at one point we learned about IOMT and the safe removal of mercury, and we're like, well, I was excited to learn that, and then obviously fluoride, and then root canals, and then and that was mind blowing. Learning more about root canals through lectures, through IOMT, and then you start realizing you can get trainings done with other dentists that are like-minded. And so it just kept evolving. And because of our passion about personal health and nutrition, and like I said, and just this concept of really believing in the human body and its natural intelligence and not interfering with it as much, that was just the mainstay throughout this whole process. I believe in the human body. We evolved to where you are right now, and it's not ending. Right now, it's constantly evolving. And just 2 weeks ago, sorry, it's a long-winded answer, but
no, it's good. It's good. It's music to my ears, Ben. Music to my ears. Two weeks ago, go on.
2 weeks ago, my brother and I, we did some training with an amazing doctor in St. Louis. It's on the meridians. And assessing the meridians and looking for blockages in the meridians, and learned so much about how parasites are, for example, a big part of your health, and we knew somewhat about it, but learned a lot more. But he's a medical doctor, his perspective was right up there with parasites was your mouth. And he's a big advocate of biological dentistry or holistic dentistry, and getting rid of sources of toxicities that are causing health issues, but also blockages in the meridians, which actually are the same. And these blockages and meridians are causing major health issues, both systemically by the blood vessels and lymph and everything else, but also on these meridians. So it's so it never ends. To my point, I'm just it's just a constant growth, and that's what I think holistic or biological dentistry has to be. It's someone that is interested in constantly growing, if you're and questioning and growing, and if you are that person, this is the right place for you, I think.
I think that's a wonderful answer. You say long-winded. I say music to my ears, Ben, because I have often the elevator pitch for what a holistic dentist is for me is it's a dentist with attitude, and that attitude is exactly as you articulated, a recognition of how much there is to learn and an excitement about learning it. I find it really intriguing that more of our colleagues don't enthusiastically embrace this, particularly in a time when there are so many choices for patients. And the question I think a lot of health practitioners should be asking is, what defines the difference? Why would people come to see you when they probably pass 100 dentists on their way to your practice? And many of your patients would have no doubt about that. But a lot of dentists, are not as busy or as engaged as perhaps they should be.
Well, I think at the end of the day, dentists like us are following our passion. We're not just going through the motions. We're doing it. Our why is different, right? Our reason for doing this is not just the numbers. And the production and making sure the collections are correct, and it's a business at the end of the day, and that's all important. But really, at this point in my career, it's the passion behind what we're doing is much deeper. In fact, we built our facility last year after practicing for so many years. I mean, Sean, my brother, is over 30 years in dentistry, and I started in 2002, as I was saying, so quite a few years. And we had a very successful practice, but we realized there has to be more to it than just practicing biological dentistry in our space. And our vision was to create a facility where we can collaborate with other like-minded professionals. That's why we term the Smilebody, mouth and body together. Because as you preach, it's the mouth-body connection is vast, not just in meridians we were just talking about, but blood vessels and so on and so forth, and nerves. But the impact on your health is so profound that what happens in the mouth happens here. I call it the gateway to your health, but then vice versa. And if you're working with like-minded professionals on the medical side, nurses, naturopaths, integrative doctors, we can help a lot more people, I feel. And this concept where current medical system, where there's a specialist for the mouth, let's say us, right? We're the dentist. There is a specialist for the ears. There's a specialist for the eyes. There's a specialist for the skin. There's a specialist for the heart. And they just look at that. They're not looking at anything else. That has to end. I don't believe in that. And we have to not work in silos. We have to be working collaboratively. I'm a big advocate of working with naturopaths, like I said, and other people that are open-minded, understand the connection of the body, where we can make a bigger impact. And right now we're doing a lot of that. We work with different doctors from around the country, and we do a lot of telemedicine, and we a lot of times patients are not geographically close to us. In fact, more than 50% of our patients fly to us or come from a distance because of this approach. So again, it's exciting, and it's something that you have to be passionate about. And when we're building this facility, and I can tell you more about the facility, it was really not about us anymore. It was about something that has to happen. We felt a need that this is something that has to happen regardless. It's not about me. It's not about one person. It's not my vision. And as we were going through this process, it was almost a spiritual experience because one, I had to evolve. It was an evolution experience for me. And two, so many people came into our lives that without that, this project would not have happened. So you're doing something right and you're part of something good, and you're on the right track when there's alignment happening. So when that's happening, again, it's a deep why, and we felt that it's needed for many ways. Or whether it's Australia or here in the United States, people are sick. People are sick and they're over medicated, overfed. And we have to do our part to make sure that we can create a better model of health.
I mean, I think what a wonderful place to be for you with 20 and 30 years of experience between you and your brother, and for you as brothers to be on this journey together and stepping in after all that time into this new space. Very exciting time. I think you must have observed many, many times that when you're dealing with patients with complex, preventable chronic diseases like heart disease, cancer, autoimmune, diabetes, etc., how often oral health is the missing link, just totally overlooked, and yet such an important part of the issue. Is that an observation you have made in your time?
I've made that observation. I see it every day, and I'm still learning that it's in a bigger and bigger impact than I even realized. Even with this conference, at this training I went to with this doctor, that's medical doctor, I even more so reinforced how much of an impact the mouth has on the body, and it just reinforces it more and more to the point where I realized, it's just the mouth, and I hope I don't realize. I hope the more and more people on the medical side realize that if you are treating a patient, and if you're not working with a biological or holistic dentist hand in hand to make sure that they evaluate the mouth to just check for sources of toxicities or some of that come in from the mouth, then you're really missing the boat. You're not going to get the results that you want. And this is what I usually speak on when I do wellness and longevity conferences. And it's because I want to make sure that other practitioners are actually realizing that if we all, again, collaborate, like what we're doing in Smilebody, I want it to be done everywhere. The goal is we have to change, we have to evolve. And this collaboration model is, I feel, the future. And if we don't all start thinking in that way and treating the body in that way, then it's not, we're going to get more of the same, which is a lot of unhealthy people.
Well, I think for many health practitioners, not talking about dentists here, although you might include some dentists in this too, for many health practitioners, the way they do an oral health assessment is they will say to their patient who's suffering from stage 4 cancer or heart disease or autoimmune conditions, have you been to the dentist lately? And the patient will say, yes. Anything happen? No, all good. And that is the full extent of an oral health assessment. Let's just dive in a little bit here as to what constitutes a comprehensive oral exam in your practice.
Well, it's a long process, I have to tell you. One of the things that's important for us is to utilize current technology, and when I say current technology, yes, cone beam CT scans are a big part of what we do. And for your listeners, if I'm not sure, I'm pretty sure because you're a holistic dentist, this has come up in the past.
But does that okay? Let's just assume it hasn't. It has, but let's explain to our listener what that actually means.
Well, a cone beam CT scan is pretty much a 3D image of the jaw and head and neck area, I should say. And this 3D image, kind of like a CT scan that you go to a hospital, you can see it in slices from every angle. Now, it's similar in that way with one of those big machines that you go into a hospital. But what's important is that you get a fraction of the radiation. Similar, the amount of radiation you get is comparable to the full series of dental x-rays. And actually, it's even being reduced more so. And the new cone beam CT scan that we were just about to purchase right now, and we've had like 3 iterations over the many years that we've been doing this. The newest one is about 50% less radiation than the one before, that's from the same company. And ours is not even that old. So it's like, it's exciting because we're getting more and more efficient in that field. Now, as far as radiation, even the nomads that, you much less radiation for regular diagonal x-rays as well. But the point is we do our cone beam CT scan. That's important. And we do our regular checkup x-rays. But of course, again, we use some better technology to reduce that radiation beyond digital. There are these technologies. The nomad has become the name that's popular. But these X-ray units that you're actually in the room with the patient. You're not going and hiding behind a wall. It's like a little gun that you shoot, and whether the dental assistant or a dental hygienist or wherever the professional is, they're taking these X-rays. So there's a series of diagnostics that are done in our office. There's other diagnostics that we like besides the dental X-rays. There is something called, obviously, an iTero, where we can a digital scan of the jaw. We get a 3D model of the jaw that shows shows the bite and the bite forces in different areas. Helps you with seeing certain cavities.
So Ben, this would give you. I mean, some people may be familiar with having molds taken of their mouth, where a gooey substance is put in the mouth and it's not very comfortable. But now the very thing you're describing is something a little bit like a tiny camera which goes around the mouth and scans it and gives you a 3D image that
Thank
a
you
model
for that clarification,
of the mouth. So
thank you
I
for
think
that clarification.
people may have missed that. I knew what you were talking about, but I think the exquisite nature of it is quite remarkable to give you a 3D image within a minute or two of the entire mouth, allowing you to assess it. Yes, so go on. We've got 3D X-rays, we've got 3D.
Ron, to your point now, we don't have to really take those goopy impressions really anymore because we get these digital images. And so with these digital images, we can see a whole new perspective, and the patient can see specifically a whole new perspective. There are other diagnostics that we can do. We're actually adding a machine for EAV machine that we can check the meridians. That is something that we're adding soon because of this training that we just went to.
Now, Ben, technology, a terminology here. EAV is electroacupuncture. Is that what I'm hearing?
Yeah, it's pretty much a machine that uses electrical stimulus to see if there's blockages on. See, I'm going too fast, Ron. Thank you.
That's okay.
It checks on your hands and feet because those are endpoints on meridians, and you can check and see if there's blockages on your meridians. And there's actually a meridian points for your mouth on your hands as well. But you can check to see where there's blockages in your meridians. And as we were talking about earlier, these blockages in meridians are many times a source of health issues. There's another technology called Oligoscan. Oligoscan is an interesting thing that uses light to assess your tissues for mineral deficiencies and heavy metal toxicity. So because we like to make sure, obviously that's super important for us in the medical and in the dental industry. Heavy metal toxicity is a big thing. A lot of mercury fillings out there. So that's another thing that we can do. And so we put all this information together. We get an image of what's happening for the patient. Of course, we're spending a lot of time explaining and educating. Now, almost all, 99% of our patients that come to us are generally very educated. They have come to find us to find a doctor that is like-minded. They want someone that is not going to be pushing fluoride. Wants them to get, assess their root canals and get these metal mercury fillings out of their mouth safely. They're already on board with the idea that they don't want any metal in their body. They're already on board with, they don't really want root canals in their body. So I'm not really necessarily going there and explaining that from scratch. I might give them more detailed information about why I think this way, or the reasoning behind it, so they understand it better. And then we put a plan together and tell them how we do it in our office, because we have a lot of protocols to make sure that everything's done correctly. But our patients are pretty educated. They're coming to us pretty knowledgeable. We just like to expand that knowledge. And I like to tell patients, we want them to be their own health advocate. And in other words, we're not here to tell you what to do. We're actually here to support you in your health journey. There's a difference. We're not mainstream medicine to tell patients, you got to take this medication, take this shot, take this in order to be healthy or in order to get well. For us, it's a matter of, removing sources of toxicities, remove sources of interferences so your body can actually heal itself. And that is up to you if this is the journey you want to be on. It's not up to me. And if it is, then we're a great fit. We're going to support you, and we're going to have a journey together, and we're here to support. But if someone is not in line with that mentality, I don't care. It doesn't work. We're not the right dentist for everyone. But if they are looking for us, people come to us, like I mentioned to you earlier, from all around the country. And so we're very blessed to be able to help people now with the help of COVID. Telemedicine became a bigger thing. So, patients from that doctors refer to us from other states, they will go get a cone beam CT scan. And because that's the very basic way where we can assess their mouths. With the cone beam CT scan, we can see a lot. We can see sources of the main toxicities that are maybe getting them sick. Now, these doctors want their patients to get well. They see the benefit of collaborating with a biological dentist. Then what we do is assess their cone beam CT scan together and review with the patient. And if they choose, they can fly in, do a week stay where we have strict protocols with our center for preparing their body for healing and help their body heal after treatment too. There's protocols that we have that we haven't gone into on our medical side, like hyperbaric treatment, IV therapies of different kinds, and red light therapies, photobiomodulation. A lot of things that we do that can help the patient in that process. That right now it's still not at all part of the mainstream dentist or part of typical holistic or biological dentist protocols that we're trying to push the envelope on.
Now, you've mentioned a couple of times that you've set up this new centre, which I'm seeing behind you is called Smilebody. Go on, just turn a little bit so we can see that. There it is, Smilebody. But I'm just interested, you've mentioned a few things there, which are, you've obviously got your dental practice there, but you've also got other things. You've briefly mentioned other things to support immune function during this time of healing. And you touched on it, but I'd like us to just go back a little bit here. You mentioned hyperbaric, you mentioned this. What have you got? Tell us a bit about the vision of the centre.
Well, we realize, like I was mentioning, there is a lot of technology that we can utilize to our benefit that can help patients on this journey, this health journey that we're talking about. Whether we're talking about health optimization from wherever you are in your health journey, or in case of when we're doing actual surgeries or then these are, and a lot of times we have to do surgeries for these patients because we're removing infected teeth, treating cavitations or otherwise. So we are there to help the body actually recover. And there's a lot of technologies that can help with that. Now, on the medical side, I mentioned hyperbaric oxygen. Now, this is something that, at this point, a lot of people know about. It's in hospitals, usually used for wound care in hospitals, or people that were diving accidents. That's what it was known for a lot of times, to help in this oxygenation of the blood. It actually helps oxygenate the plasma. Not, when your blood, you have your blood platelets, right, where your hemoglobin has space for oxygen, has 4 sites for oxygen molecules. When those 4 sites are full, that's it, right? Now, in that blood goes through your veins and oxygenating throughout your whole body. That number one need of the body is oxygen. Now, with hyperbaric oxygen, you are now oxygenating the space in between the blood platelets, and so you're actually oxygenating the plasma at a high level. So that every part of that blood, that red blood, is now more oxygenated. So that liquidy part of the blood can get into areas that the actual oxygen, hemoglobin, and platelets cannot get to. So you're now oxygenating. So if they have areas that are having a hard time healing, then right now mainstream medicine is using hyperbaric oxygen to help those areas heal. They dramatically heal much faster. But it can be used for so many other things as well. Besides that, anytime we do oral surgery, that will help that surgical site heal much faster. It can help your brain fog, even eyesight. And I mean, again, oxygen, number one need of the body. At every level, the body needs this oxygen. And a lot of times we're deficient. We're deficient on proper oxygenation. So hyperbaric oxygen is useful for a lot of that. But as far as our protocol, surgical protocol, it's a big part of it. Another thing is our IV center. Now, our IV center, there's different kinds of IVs that can be done. The typical IVs that people know about is like vitamin C and, maybe, vitamin B12 and maybe glutathione. And of course, there's like NAD. People know about now is, it's a boost. NAD is going to be good for longevity. And, these things, people know about Myers cocktails of different kinds. And, they help boost your natural ability for your body to heal and recover. Then you're feeling sick. But there's a lot of more in our IV center. Ozone, for example. Ozone that I'm sure well familiar with is O3. Instead of O2, it's charged oxygen. And this is what's found in our ozone layer. Now, again, I know about this, but for the benefit
don't now, Ben, you're just not talking to me. If we were having a cup of coffee, then I appreciate you acknowledging my knowledge. But let's not assume all these things, because keep going. This is fine. I mean, the hyperbaric chamber that you're talking about is a chamber that people sit in.
A hard shell chamber.
A hard shell chamber that, under pressure or atmosphere, is delivering that oxygen. The IV or the intravenous protocols that you're talking about, you were just mentioning. So no, don't assume.
Okay, so
you're not offending me.
The hyperbaric, you go in it for an hour, and you're just you hang out in there under that pressure, and it just does wonders. You feel more clear-minded when you come out. You see a little bit better, and there's different kinds of protocols you can do that for different purposes. The IV we mentioned, again, there is ozone IVs, and for the benefit of people that don't know what ozone is, like we were saying, that's where we left off. The ozone charged oxygen is something that's been around for a long time. Utilized in surgery rooms back before really the chemicals were used to clean surgery rooms. Ozone was used to clean surgery rooms in preparation for surgeries. It's a great way to kill bacteria, viruses, parasites, mold. So it's something that we use in our office throughout. On the dental side, we use it in our water systems. we ozonate our water. So when we get a cleaning, we use ozonated water. For surgeries, we want to clean the bone. We use ozone water to clean the bone. We can utilize it on small cavities to ozonate that surface cavity maybe. It can actually eradicate some of that bacteria that's causing that on contact. Actually, it's a stronger killer of bacteria than any antibiotic. So it has a lot of benefits. It also has anti-inflammatory, increases circulation in an area. We can inject it in an area where there was an abscess. So a lot of benefits. But in the IV room in particular, we can use this machine actually from Germany. There's a few different machines on the market now. This one is called a Zossman. There's another called EBU or EBU 02. These machines, what they do is you can take a little bit of the blood out, you ozonate it. In other words, you run ozone through it, and then that's put back into the body. And this has many effects. Now, detoxing, anti-inflammatory effects, people that have been exposed to mold, for example, and has a lot of ways it can help clean the blood and oxygenate it at the same time. Again, having oxygen is a good thing. So ozone, it breaks down into oxygen. O3 breaks down to O2. And so that's another one. Another machine that we do in our IV from Germany also is called the Weber endolaser, which uses different wavelengths of light from red, infrared, ultraviolet, green, blue, to actually on inside the blood vessel, and it puts that light against the actual blood as it's passing through, and you get the benefits of that wavelength of light. And light being light and sound, really, I would say the future of medicine, and also a lot of ancient technology comes from sound and light. So we want to utilize this newer technology that we're talking about, but also AI. And when I say AI, I don't mean artificial intelligence. I mean ancient intelligence.
Interesting. Nice one, Ben. I love that.
So utilizing that AI.
It's a theme that I feel really passionate about because we've got so much to learn from AI, as in ancestral information.
Exactly.
Go on.
And we've put a blind eye to it. You know why? And whether you're talking about Ayurvedic medicine, Chinese medicine, these are thousands of years old. And if you go even farther back, it's amazing, right? What we can learn, but we're ignoring it. And obviously the pharmaceutical industry and has taken over the medical field, and we're just narrow-minded, looking for answers in a pill. And of course, not our solution. People up our alley, as far as me and you, Ron. We want to help the body, yes, but if we can use sound and light and something called photobiomodulation, which is about using light to help your body heal, and red light therapy, like for example, we have an amazing red and infrared light bed in our office that patients can utilize. So there is these technologies that are new, but at the same time, it's based in ancient technology. And using sound and light it's not new. It's something that's known to heal.
Yep. Hi, Dr. Ron here, and I want to invite you to join our Unstress Health community. Now, like this podcast, it's independent of industry and focuses on taking a holistic approach to human health and to the health of the planet. The two are inseparable. There are so many resources available with membership, including regular live Q&As on specific topics with special guests, including many with our amazing Unstress Health Advisory Panel. Now, we've done hundreds of podcasts, all worth listening to, with some amazing experts on a wide range of topics. Many are world leaders. But with membership, we have our Unstress Lab podcast series, where we take the best of several guests and carefully curate specific topics for episodes which are jam-packed full of valuable insights. So join the Unstress Health community. If you're watching this on our YouTube channel, click on the link below or just visit unstresshealth.com to see what's on offer and join now. I look forward to connecting with you. And when you say sound, I mean, we've done a program on shockwave. Is that what you're talking about, that kind of technology? What is, when you're talking about sound, explain that one a little bit more to me.
In our office, we don't necessarily use the shockwave, or I know what you're talking about, but I'm saying as far as sound is known to have healing potential, and that's also light. Now, but in our office, we're not really utilizing those different shockwave or sound or ultrasound or low frequency ultrasound. There's these technologies that can be utilized for healing, for even body sculpting. There's this different technologies that we've actually thought about incorporating, but we know 100% that your body resonates. It's actually a electronic system of sound and vibration. So your body is not just a car where you're going to change the carburetor or change the wheels when they're worn down. It's a system that is mainly vibration and light and sound. That's where building blocks are, right?
Yep.
If you go down to the quantum level, there is not really any kind of mass. We're all empty space, and we're just potential frequencies. If you right. So we are everything that's in us is just energy and potential frequencies. What we do right now is I'm glad is that this industry where we're in, and more people are looking at is how we can actually heal in more ways than one, which is the only way that was been accepted for quite a while now, from back when Rockefeller got into the medical world and created the pharmaceutical industry and took over the medical schools and created this dogma. And this was the way it was going to be. And that permeated throughout the whole world, and where you are and where I am across the world. So this is our. So for now, I feel like we are embarking on something special. The next chapter of humanity, I feel, is very exciting because this philosophy that we're talking about isn't fringe. It's actually more and more accepted. And it's something that we know to be true because there's scientific proof behind it. Now, people like Joe Dispenza, that you might know, I'm sure.
Or Jack Cruz.
What was that?
Or Jack Cruz.
Or Jack Cruz?
Yeah, very familiar with. But what you're talking about is this ancient energy which has brought us after 4.5 billion years to this point, and that is the quantum world that we all live in.
Exactly. So, so much we realize that our ability to heal ourselves as far as utilizing meditation and our own natural ability to heal and just our own belief and mentality can be so healing by itself. And again, mind, body, spirit is such a big component of of health and healing. So, getting back to the clinic, to answer your question, we felt that we have to utilize these technologies, rely on the medical team, our nurses, I should say, our MD medical director, naturopaths, to collaborate with them. We even have an esthetician that's like-minded for the skin, which is the biggest organ of the body. So we feel like that's a big component of your health. One of the biggest components of the microflora, besides your gut and your mouth, is the skin. So your skin has this vast amount of microflora. So if you want to get healthy on the skin, then you get that beauty that you're looking for. Well, you know what? Why not have a esthetician on board? And And then another big component for us was the children. And so we created a pediatric component to this office too. We have a holistic pediatric dentist on the team, and we have a whole clinic. It's a 7,000 square foot space. It's big. So we have a pediatric component because that's, I'd love to discuss kids more with you, because that's a big component, and getting them early and addressing their jaw development and airway is super important.
Well, you'd be pleased to know we've done a program called Quantum Kids, and one of my mentors, which is a young dentist, I consider him to be my mentor, who reintroduced me to quantum biology. I'd been on this holistic journey for 40 something years, and probably 5 or just over 5 years ago, I met him, and he kind of said, whoa, hang on, don't forget about the quantum world. And I thought, what the hell? How did I miss that? And that's been a whole very exciting learning experience, and empowering too, because it's so available. I mean, the sun doesn't get much easier than that. The earth doesn't get much easier than that. And harnessing that kind of energy is very inspiring. So this is music to my ears, Ben, and what a wonderful facility. Yes, let's talk about kids, because that's where it all starts, isn't it, really?
Yeah, and unfortunately, it's like you said, it all starts, the level of unhealth or health that we have in our countries, it starts with the kids. Number one, what we're feeding the kids, right? And ourselves, but also, how they're developing, which is related. Now, obviously, we know that from the work of Weston A. Price that nutrition is so important for your development. And in the world of Weston A. Price being a dentist in the 30s, and a researcher, that he discovered that when he went to indigenous villages that were not exposed to westernized culture, that did not eat the crap that we eat in our world of processed foods and sugars and all the crap that's out there, that's not really food, they did great. They were healthy. Their jaws developed beautifully. There was no cavities. Their teeth were straight. Horrible hygiene. They didn't brush their teeth, but it didn't matter. They had all the teeth, and they were beautiful, healthy people. Okay, so that's why I always tell people, it's not just about hygiene. Hygiene's great, but it's about everything else that you do that really matters. So what we realize is that this environment that we live in is creating sick children. And what's happening is the diet, number one, and then other things that we do, like thumb sucking and pacifiers, things like that, are deforming these kids' mouths. Now, all this, the diet, these other things that we do with like thumb sucking and pacifiers, are deforming our jaws and at these kids at these very young ages, and also causing inflammation throughout the body with the tonsils and the adenoids. So this combination of the deformed jaw and inflammation causes a lack of airway. Now, for kids, for adults, that's a big deal. For kids, I would say even in some ways a bigger deal. Even though for adults, it's probably one of the number one killers, that it's underdiagnosed as far as being underdiagnosed. But for kids, jaw development is super important, because when their airway is not expanded, their jaw is not expanded, there's not enough room, their teeth are crowded, they're getting cavities, they can't breathe at night when they sleep. They get a specific look. It's a tired look, mouth open, jaw protruded, what we call a class 2 bite, where the lower jaw is behind it because it's always open. Their jaws develop incorrectly. We have the maxillary palate narrowed with a high roof into the nasal passageway. These kids can't breathe from their nose. And then they're inflamed, and their adenoids back there is blocking the airway, and their tonsils blocking the airway. They can't breathe. So what happens when you can't breathe? You're not getting oxygen during a critical time, your sleep. So when you're sleeping, these kids are sleeping at night and they're not breathing well. They're not getting enough oxygen, a very important hormone is not being released? Growth hormone. So when there's not enough growth hormone being released for these kids from 4, 5, 6, 7, 8 years old during that critical time, their mental and physical growth is stunted. And they get behavioral issues like ADD, ADHD, and they can't focus in class. So, and then what do? Medicate them. Let's medicate these kids because they can't sit still. So for us, obviously, we want to not medicate kids. We want to get to the root cause of the problem. And for us, our holistic pediatric dentist not only focuses on prevention of cavities and treating those cavities in an environment where the child feels comfortable and safe and maybe enjoyable with cartoons and all that kind of stuff. But all that's fine. But let's look at their development. Let's make sure that they're developing, because so many kids. We were just having a meeting with our pediatric dentist yesterday, Sean, my brother, and her, about arch development, and there's so much deficiency in their maxillary arch, in their arch development, and it's overlooked, and these kids are suffering. So if we address this at a young age, and get their jaws to develop, not only are they going to be mentally and physically growing, not only are they less likely to need braces and be years and years of braces, what we call first phase orthodontics and expansion. All that sets them up so that they can have an adult life that is actually healthier and aligned on be on a journey of actually health instead of sickness, and living in a life where they're disadvantaged. It's a big disadvantage.
I mean, you'll be pleased to know that we also did a program with a pediatric respiratory specialist who shared a statistic that was a real aha moment for me. And he said 50% of kids that are diagnosed with ADHD, attention deficit, have an undiagnosed sleep disordered breathing condition.
This is it. This is what I'm talking about.
Yeah,
and there's countless studies on this, Ron, right?
Yeah.
If you go on PubMed and you do search sleep apnea and ADHD, please, someone go do that right now. And if you do that, you'll see studies and studies and studies and studies. And then all these poor kids are being put on meds. And they're not. I had one of my assistants she's been my assistant for probably 8-9 years. She was talking about her child and behavioral issues, and they want to put him on meds, and he's having a hard time in class, and all these things. And I said, have you done a sleep study? No one ever brought that up. So lo and behold, obviously he has sleep apnea. They address the sleep apnea. He's growing. He's mentally, physically growing. His behavior has changed. She is just in tears of how much of a difference this was impacting him so much in their lives. And they were sending him to speech pathologists and all these things, but not ever addressing the glaring fact that he can't breathe.
Yes. Yeah. I mean, you mentioned also that part of a holistic biological approach to dentistry is also about sleep medicine. You've got very involved with that, and I have too. That's certainly over the last 20 years become a very big part of holistic dentistry. It often surprises me, I'm sure it does you too, when you're taking a history that a person's been on antidepressants for 20 or 30 years, and your next question is, have you ever had a sleep study done? And the answer so often is no. Has that been your observation?
Well, there's so many things that we are taking medications for in our countries that we should do a sleep study for right away.
Yeah.
You mentioned antidepressants, which is one of the number one medications that are prescribed. High blood pressure medication, which is one of the top 10, right? All these are going to be top 10. And if you've had a stroke, right, you're going to take medication that thins the blood or something like this. These are all highly medicated prescriptions. And another one in the world of dentistry, if you grind your teeth, you should get a sleep study. And dentists are not even looking at that at all. And they are just giving them this plastic appliance to wear at night, which does one thing. It keeps from the teeth from rubbing on each other, and it protects the teeth, which is great, but is not addressing the root cause. So a lot of our world is addressing symptoms of the world of medicine. Now, our world, I guess you could say, Ron, you and I, we want to address not just symptoms, but root cause. So if when we see a patient come in the door, I mean, so many people, we have to talk to them about their sleep. And they're actually surprised a lot of times why I'm talking to them about their sleep.
Yeah.
When I see these kinds of meds that we're talking about, or another one, erectile dysfunction, that's an common medication people are taking, right? Viagra. So erectile dysfunction also highly correlated with sleep apnea. So again, oxygen, when it's the number one need of the body, it affects you in every level. It's sad but true, and it's something that when you look at these things, and again, us holistic-minded practitioners, we want to look for root cause. So when we see a patient that is, has all the signs, we in our office we do a sleep study, and we want to assess and see what's happening at today. I probably recommended maybe 4 sleep studies out of my patients. So it's something that a lot of times it can save a life, not just the tooth, but you can actually save a life for these adults. So many times these people that fall asleep at night and don't wake up the next day, it's really very commonly sleep apnea. And they had a heart attack because the heart is pumping. There's not enough oxygen getting into the heart, and it gives out after some time. So increased chance of a heart attack by 23 times. So this is real. And for us, as you can see, I get super passionate about this because it's so important to be addressing these things.
Yeah. Well, this comes back to when we started this conversation about you commenting that you're living it, that you take it seriously in your own life. And I often feel that, I'm surprised that their doctors, their specialists, all the people they've seen haven't suggested, say, a sleep study or going to see the dentist. This is often a reflection of the practitioner's own life. If they don't take sleep seriously in their life, they will not be recommending it to their patients. If they don't take their oral health seriously in their life, then they won't be recommending it to their patients. One other thing, go on. Did you want to comment on that? Because
I was just going to say the sad truth is that most people in the medical doctors and or dentists, we don't know the first thing about sleep apnea from school. It's literally nothing. Medical doctors that at one point after we had our diploma, we were training MDs to screen their patients. Integrated, start looking for it. Don't just wait for them to ask you for it. If you're not looking for it, you're just giving a prescription for something that they don't need. So yes, go ahead. It's mind-boggling that something so important is so overlooked in the medical field completely.
Yeah, and often people are surprised that they're sitting in a dental practice and this is the first time that someone has even raised this issue with them. You talked about the mouth as being the gateway to health. Well, it's certainly the gateway to the respiratory tract and it's the gateway to the digestive tract. So if you think sleeping, breathing and eating are important, then we're in the right spot. I notice you're very excited. You've learnt recently about meridians, and we've talked about AI, ancient intelligence, because Chinese and Indian, talk about energy flow through a body and meridians. Tell us a little bit about this journey that you're now excited about as well, and the meridians that tell us about meridians in that.
I could say I expanded my knowledge recently on meridians. We know 100%. I mean, if you go throughout my office right now, many of the exam rooms have a big poster of the dental meridian chart. So it's something that I've been talking to patients about extensively because I understood that, and I'm a big fan of, for example, acupuncture. when I've had herniations in my neck and my back. So, once in a while it gets aggravated, the muscles tense up, and, so I go to the acupuncturist and he puts the needles, but he doesn't just put it in your back or your neck. He actually puts it on your hands and your feet also, because that's how we can get some of the energy flowing in the right way on these meridians. And these meridians are energy lines, again, known for thousands of years in many ancient traditions, to that when there's energy blockages in those energy lines, there is health issues that arise along that energy line. Now, there's different meridians, like the probably most common one is the gallbladder meridian that goes from your feet all the way up your side and all the way around your head. And if there's a blockage in your gallbladder meridian, it actually, you can have everything, any kind of issues from a problem in your feet to brain fog to pain on your side right here, because it zigzags right here on the side of your body. It's hard, having a hard time to focus, or even hearing in your ears is ringing. A lot of that is a blockage in your gallbladder meridian. So it's a very common one. And it's a lot of times not even considered, because again, with our world of westernized medicine, when I say our world, as opposed to Chinese medicine, we're in between. But the westernized medicine, if you have a pain on your side, they look at that area. But Chinese medicine doesn't look where the pain is. They look at the whole body. And for us, holistic practices, this resonates, because we also like to look at the whole body. We don't want to look at the mouth when there's a mouth problem. If there's bleeding gums, we're not going to just say floss more. We're going to say, well, what's your diet like? What's your oral microflora like? What's your mineral? You might have some mineral deficiencies. Let's see what your vitamin D levels are. If you have a lot of cavities, let's look at your vitamin D levels. So we're looking at your whole systemic health. And with meridians, this is also looking at the whole body. Now, one of the things that I learned a lot from this one course with Simon Yu was a little more about parasites, because what he shared about is one of the mainstays of blockages and meridians is the mouth for him, which is heavy with metals, infected root canals, and of course something else called cavitations. These are sources of toxicities and dead tissue in the jaw or metals that are causing a block in the meridians. But also for him, parasites. For him, it's a big part of what he does is deworm. Why are we humans not getting dewormed, where other animals are always getting dewormed, but humans are not? And guess what? We have them too. And that's causing many health issues, from cancers to autoimmune disorders to these blockages in these meridians, like the gallbladder meridian. And when you address this, you heal, you get better. When you address the blockages in your mouth, you heal, you get better. So it's amazing. Again, AI, ancient technology, intelligence that we want to actually embrace and actually to improve health at many levels. So more than just fixing a tooth for function. And that's what the dentist's job has been traditionally, is fixing a tooth for function, getting a patient out of pain. And if you're really ambitious, maybe make it prettier. But that's it. Stop there. That's your zone. You're not allowed to look at overall health. But really, again, if you have the right mindset, you can be the quarterback. You can be the quarterback for these patients that usually see their dentist more than their medical doctor. You can be the quarterback to help guide these patients in the nice trajectory for they're on this health journey, by looking at them holistically and see it from that angle.
And I think it's worth saying, Ben, that you still do. Yes, I think that's right.
My lights went off in there.
That's right. I think it's worth reminding our listener too that even as a holistic dentist, you still do fix teeth.
Oh, absolutely. So
Yeah,
we do
because
fix teeth.
but
Thank you for saying that.
do you guys still do fillings? Do you do crown? I go, no. I used to say, I had some patients have a very far out idea of holistic dentistry, and I would joke with them and say, no, I never pick up a drill. I just put my hands on the patients, and it cures them. It just does that. And people go, really? And I go, no, that's a terrible joke. We still do dentistry. We still do basic dentistry. We just do it with an attitude.
Well, we do it with an attitude, and that attitude is we want to be very choosy on what materials we use. We don't want to just put in any material in the mouth that the person's given us in the dental world, the vendor. We were choosy. Whether it's obviously we avoid the metals that we talked about, but even the composite resin fillings, most of them have a lot of BPA. And so we have to choose wisely which materials we're using. We want to use porcelain whenever possible so that it's more biocompatible. Even for our dental implants, we're placing ceramic implants as opposed to the titanium implants. When we do our surgeries, we utilize something called PRF, platelet-rich fibrin, which is a great way to help utilize your own body's potential for healing by using your own blood after it's been centrifuged and get growth factors from your own blood. So yes, we do a lot of what mainstream dentistry does. It's, I would say, more thoughtful. We actually think more deeply about what we're doing. Does this make sense? Is this the right way to handle this situation? Can we be less invasive? Can we avoid doing a full coverage crown and shave away healthy parts of the tooth? For me, I want to be conservative, save healthy parts of the tooth and do a partial crown, and avoid the typical crowns and aggressive dentistry that's done that a lot of times leads to the nerve dying, and then a cascade event that leads to a nerve dying and a root canal and then ultimately tooth loss. So it's for us, do less. Less is more, but also if you are going to do something, use the materials wisely, use the right materials so that they're at least not impacting the body in a negative way.
Now you had mentioned, and I think our listener may have missed it too. I mean, you mentioned this silver mercury amalgam fillings, which are, they used to be called silver fillings, but hey, guess what? Half of the material's mercury. Who would have thought? But removing it is a challenge, and one could argue you're almost better off leaving it in than removing it carelessly. And you mentioned the IAOMT, the International, Oral Medicine and Toxicology, something like that.
Yeah.
They have what's called the SMART protocols. Just remind our listener, because I think it's worth reminding them to be a little bit cautious about the removal. And this is true for the dentist as well as the patient. What did you learn from them? What was the lessons from them?
Well, number one, all metals are toxic to the body. There's no place for any metal in the body. And mercury happens to be the most toxic. And these mercury amalgam fillings have more mercury than any other ingredient. In fact, more than 50% mercury. And they taught us in dental school that this is an amalgamation of multiple metals. That's why they call it amalgam. And when you put them together, it makes it so that the mercury is not released into the body. Oh, great. Thank you very much. Let's go play with it and put it in the mouth. But the reality, we know 100%, this is not up for debate, that mercury is being released by these fillings on a daily level for if you have a mercury amalgam, silver, whatever you want to call it, filling in your mouth. And how is it being released? From just any surface tension, meaning if you brush, if you floss that area, if you eat or grind your teeth, anything you're doing when you rub that mercury amalgam filling, there is actually, if you go to the YouTube, I'm sure you've seen it, is a smoking tooth. It shows with the right fluorescence that how much of this very toxic material is being released, except there's no odor, there's no taste. You can't tell it's happening. You're just inhaling it, and it's going into your body. Now, when it goes into your body, it gets trapped. That's why they call it heavy metals. And the heavy metals means you can't get it out. but your body, in its natural intelligence, absorbs it and stores it in tissues. It stores it in usually fatty tissues, but that bucket gets full after some time and overflows, and then it goes into organs. As it goes into organs, it'll go into maybe kidneys, liver, but also the brain. As mercury being a major neurotoxin, what we see is neurological issues. The Mad Hatter, we knew from well before all this that if you have a lot of mercury toxicity, you go mad. So this is not something new. In fact, back when they introduced mercury fillings in the 1800s, people already knew it was bad. People already knew. They're like, what the hell? We don't want to put mercury in people's mouths. And the ADA, or American Dental Association of that time, it was called something else, I can't remember. But they said, no, we're not going to put this toxic material in people's mouths. But of course, with the system as we have it, they took down that academy, and they said, no more of that. We're going to create the American Dental Association, and we'll put dentists in charge that accept this. And now there's mercury fillings. And it's been that way since the 1800s. Of course, we are still treating it horribly in this country, where we are placing it in kids and pregnant women and adults of all kinds. A lot of other countries have actually outlawed these mercury amalgam fillings. And many parts of Europe have outlawed it. Actually, I think all of Europe as of 2025 is outlawed it. In Russia, outlawed it in the 70s, actually, late 70s, they outlawed this material. But still, in the United States and in Australia, we're still placing it. And it's to the risk of not just the patient, but the dentist team. When removing this mercury material, like you said, it's better to leave it. I always tell people, do not take out your mercury fillings unless you do it with someone that's qualified and trained to do it correctly, because the amount of mercury toxicity that is released from that drilling process, the drilling process releasing the vapor and microscopic particles of these mercury is tremendous. A lot of people actually get sick after this process when they did it incorrectly. So it's better to wait and do it the right way. And what's interesting, in our country, we are not allowed to have this material go down the drain. Yes. We have an amalgam separator, which means that we can't let it go out of the drain because it's toxic for the environment.
Yes.
But we can put it in the mouth and we can drill it out and we can inhale it. So it's interesting how they have these regulations that we all have to have this amalgam separator, and it's not allowed to go down the drain, but we can still drill it out and inhale it. And the poor souls, like me and you, at one point, we were drilling mercury fillings all the time, unsafely. And we were exposed every single day to this mercury. So it's unfortunate. At this point, we know way better, but still, this has not changed. So hopefully we will see it in our countries too, and this material will be outlawed because there's better options.
Yeah. No, the irony is in our country that, as you say, it is against the law for environmental reasons to put the leftover material into the garbage, the toilet, or down the sink. It's too dangerous for that. The only safe place, according to our NIH, it's called the NH and MRC, or our TGA, which is your FDA, the only safe place, according to the authorities, to store this toxic material is in a human being, which defies logic, but it's sobering. The other interesting thing, Ben, is that I don't know whether you're aware of this, but if people Google the 47 worst jobs for your health, this is the US Department of Labor. And I can imagine if a dentist is listening to this who doesn't agree with this, they'll be going, oh, this is such a load of BS, this is rubbish. Well, the US Department of Labor do a study of 950 jobs, the worst jobs for your health, and dentists, dental hygienists, and dental nurses come up in the top 5 of 950 jobs. So, hey, take it seriously. It's affecting our health, or dental health, as well as patient health as well.
It's a tough job, right? It's a
It's a
tough
tough job.
job physically, mentally, and not to mention toxic.
Yes.
So it's no joke. And a lot of times people ask, why do you think dentists have a high suicide rate? So
Yeah. Yeah.
you get
Yeah.
that a lot. It's a very tough job, and it's very toxic, and you really have to handle a lot, and it's no joke. It's not for everyone.
No, no. And the sobering part of that study in the US Department of Labor is they use 5 criteria: exposure to toxins, exposure to microbes, exposure to radiation, and being seated. And dentists come up in the top 5, but they don't even factor in stress into that. So add stress to that, and it's a wonder we're still alive, talking to each other as we are now, Ben. But there we are. Listen, so good to catch up with you and talk to you about some of the exciting things. We've done a lot of programs on oral health. It's a passion of mine. It's the missing link in dentistry. I wondered if I might ask you this final question, because we're all on a health journey in this modern world as individuals. So taking a step back from your role as a holistic dentist and putting your individual hat on, what do you think the biggest challenge is for us as individuals on that journey in this modern world?
The biggest challenge, as far as
Being healthy.
what's our biggest challenge of being healthy?
Yeah, as individuals.
Well, I think the health mindset is number one. I mean, number one, I think it starts up here. The head, right? We said the mouth is the gateway, but if you go a little higher up, it's a mindset. Now, number one, it's this journey of actually questioning and wanting more answers than just listening and following. I think that's number one. If you just listen and follow, you're never going to be healthy. If you just wanted to just have someone tell you what to do, that's not going to be the solution. If anything, we learned that from COVID. Right. But number two, I think a lot of times, as you might know, certain people are not in the mindset of being healthy because they have a mentality of that is not healthy. For example, they are a victim to their situation. They're a victim to circumstances, and they're never going to be healthy. So whether they diet or exercise or eat right, they're not going to be healthy because they're always a victim to every situation. So I think if you have the right mindset of no matter where you are in your life or what you've been through, being present in where you are and looking in the direction of where you want to be. I think that mindset has to be there. If you're focused on what is and what has happened or what could, and being afraid of all the different possibilities of what could be, then you are living in a mindset of dis-ease. So number one, I believe it's a mindset. So if you're in the right mindset, living in the right vibration, right? If you could say, if we're living in that mindset of health and healing mentality. So no matter what is happening in your life, you are focused on health and longevity and feeling well and looking in that direction, you'll get there. Now, if you're constantly looking at your disease or health issues or issues that have happened in the past, well, you're going to stay there. You're never going to grow. And at times, as healthcare providers, we can't help everyone. We're not in this, unless they are ready to take that go on to that next chapter of actual health. We're not going to be able to help them. That's why it's great when someone is already there and they come find us, and we're here to support them on their journey. That's what I always say, is we're supporting them on their journey. They're the drivers on their journey. So that means that they're headed in that journey anyway. We're here to support. So I think the biggest part is that, number one, is what happens between the ears and how you think about your life and every day. If you're taking the very important vitamin G, you know what that is?
Go on.
Vitamin G, gratitude. If you're living in a state of gratitude, that is probably the most important vitamin you can take. And what you're doing then is you're aligning your energy with that full potential. When you're in a state of gratitude, you're now vibrationally aligned with health. You're vibrationally aligned with all the wonderful positive potential out there in this universe. But if you're not in that state, I don't care who is your doctor, who is, what medicine you're taking, or what even common treatment modalities or detoxes, or any kind of heavy metal detox you can do, or IV protocol, or hyperbarics, or all these other technologies, biohacks that are out there. If you're not in a mindset of healing, actually true healing, you're not going to be aligned with that potential.
Well, Ben, that's a great note for us to finish on. It's been such a pleasure to talk to you. I am grateful for your time and your contribution and your journey. And thank you so much for joining us today and sharing your knowledge and wisdom with us.
No, it's a pleasure. As you can see, I'm passionate about it. I like to, like I said, I like to speak at longevity conferences on these topics. As you can tell, I could keep going on them. And it's exciting. I feel like this is what I'm drawn to do and I'm called to do. And I do different little videos on our social media platforms as well. It's my Smilebody is our social media handle, and obviously our website is also mysmilebody.com. So we're passionate to get this kind of information out there so that people can learn and grow and heal themselves a lot of times with some help.
Thank you.
Ron, thank you. I appreciate you having me on.
Well, I love that. I feel so infused and empowered, and really, it's a real eye-opener for me. And I loved Ben's use of the term AI. No, not artificial intelligence, ancient intelligence. And I have often said that we have so much to learn from the ancient wisdom of our forefathers. And I also loved his vitamin G, which is gratitude, which is one of the most powerful vitamins we all have access to and should all practice regularly. We'll, of course, have links to Smilebody, their clinic, and I hope this finds you well. Until next time, this is Dr. Ron Ehrlich. Be well. Feeling stressed, overwhelmed? It's time to unstress your life. Join the Unstress Health community and transform stress into strength. Build mental fitness. From self-sabotage to self-mastery. And together, let's not just survive, but thrive. Expert-led courses, curated podcasts, like-minded community and support, and much more. Visit unstresshealth.com today. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast express their own opinions, experiences, and conclusions.